Thank you. When Steve invited me to moderate for this session, I got kind of a smile out of it because I spent my entire career in HR, and this is the same conversation we have been having for the past 40 years. But it's absolutely relevant today, and the landscape is constantly changing, so I'm really looking forward to this. I would like to first go down the line and have each of you introduce yourselves and say not only a bit about your background, but also the makeup of your workforce, which I think is really relevant to this conversation.
Awesome. Hello, everyone. I'm John Harold. I work for SoFi at Work, which is within SoFi. If you haven't gotten direct mail from us or seen us on TV, SoFi at Work, we offer student debt and financial well-being benefits to over 1,100 companies to help them attract and retain talent. The makeup of SoFi, we are about 3/4 salaried employees and then 1/4 hourly.
All right, hey everybody. I know it's been a long afternoon, so appreciate you still being here. Sean Hughley, Director of Sales at Forma. I'm based out of Kansas City, Missouri. Been with Forma for the last 4 years. My wife actually runs an HR consulting firm, which is focused on employee experience, listening strategy. So I like to say this is the family business. I have 2 young kids, so I've got a 9-year-old and a 4-year-old, and my joke is I'm slightly exhausted at all times. So if you're parents of young kids, you get that. And then Forma, we're a flexible benefit spending platform. We'll get into that in a little bit. But the makeup of our workforce is we're 100% remote. So we've got an extremely diverse team all across the globe. Really unique. I wish we could go to the office every once in a while, but fully remote workforce, about 300 employees.
Nate Nevas from Pitney Bowes, I'm responsible for benefits at PB. And we have a very diverse workforce. So we have a large hourly employee population that they're essentially in production facilities, sorting mail, low skill, English as a second language, large immigrant population. And then at the same time, we have a large engineering population, corporate employees, with, engineers with advanced degrees, et cetera. So it makes for very interesting and challenging times when you have to communicate with all of them. You've got to give them benefits that are going to meet such a wide diversity of needs.
Hi, everybody. I'm Cory Rose. I am the Senior Vice President of People and Total Rewards at TAG, the Aspen Group. We are a multi-brand retail healthcare company. If you know Aspen Dental, that's us. That's our legacy brand. We are headquartered here in Chicago. The makeup of our population, I would say, is really interesting in that we've got folks who are obviously highly paid doctors, veterinarians, dentists, but then we have a large group of hourly employees. And as anybody here in the room is in healthcare, you know that that's a very challenging area to hire for. And I would also say what's important to know about us is about 60 to 70% of our workforce is women and women in the childbearing ages. And so that plays a lot into, our strategy and how we think about things.
Thank you. Okay, so our discussion today is about balancing the increasingly high costs with employee outcomes and satisfaction. So I want to start with Nate on this. And start with the subject of cost. So at Pitney Bowes, what is driving the cost of your benefit plans?
Okay, so driving the cost, it's always medical. I mean, you can't get around it. It's the largest budget item. It's the most unpredictable, and it's the hardest to control. Other than that, it's a piece of cake. It is, because there are other things, something like the 401k. It's essentially, it functions as a percentage of compensation. It's fairly predictable. But the concern is always over medical and how much you're spending and what's the budget. Are we over budget? Are we below budget? Do we have a bunch of high cost claimants this year, et cetera? That's really where the concern is. And what are we doing from a planning and strategic perspective to mitigate those costs, but at the same time, not impacting quality?
So what are some of the things that you have done successfully to mitigate the cost in your medical plan?
So it's really a combination of things that are behind the scenes and some things that are more employee facing. So for example, with pharmacy, we carved out specialty pharmacy and to a group called Archimedes. That's been a tremendous cost savings there. That's obviously employee facing. And then we have some other point solutions that we do that really much more of a niche. But then we've done other things behind the scenes that employees may not necessarily notice. For example, working with groups that come in, audit, look at how much have the claims been processed correctly, things such as that. And then one of the other things we did too about a year and a half or so ago was we switched from UHC to UMR, which is still within the UHC family, but it's their TPA within the UHC family. It's a different platform from the UHC platform. The UHC platform is very inflexible, a little bit clunky. I hope there's no one here from UHC. But their TPA, UMR, it's much more flexible. It's easier to do more point solution carve-outs. And we went in there with the premise that they're going to do a better job of processing claims, and it will be cleaner coming out the other end, and there will be some savings there. So that's one of those things where from participants' perspective, it's the same doctor network. It's just instead of UHC, now they have a UMR card. Doesn't really impact them that much, but behind the scenes, there's a lot of savings going on.
Oh, that's interesting. I'm going to ask this next question of Cory. As far as the Aspen group goes, what's been your experience with the benefit plans, and what are you doing about cost mitigation?
So when I joined the Aspen group 3 years ago, I inherited plans that were antiquated, a broker who was not looking at innovation, was not really looking at plan design, was not really looking at, how do we truly innovate in a very unique setup? And what I mean by unique setup is that within our largest brand, Aspen Dental, our dentists actually own their own practices, and so that creates its own challenges from the standpoint that we have a multitude of FEINs, which of course is, if we try to go self-insured, which at 23,000 employees, it's insane that, we weren't self-insured. We spend about $115 million a year on benefits. Similar to what Nate said, it's one of our largest line items outside of salary and real estate. And so when I came in, I really put on the lens of, we've got to figure this out, and we've got to really bring these costs down and do so in a way that we're getting people what they need, but at the same time, we're not jeopardizing, we're not continuously just throwing money into PPO plans. And so partnered with a really great broker, left our last broker, and we're able to set up an association, not for the benefit of benefits, but as a way for us to really carve out our four walls employees into one group, that we were able to create a minimum premium plan, and then carving out our corporate structure, which is about 3,000 people on our plan, to go self-insured. And so 24 was our last year self-insured, and I think we're going to hit a savings this year of, $5 to $7 million. We obviously, all the claims haven't come in, but it was through partnering with, decision-making tools up front. So through open enrollment, having employees really figure out, what do I need? What do I use insurance for, right? And a lot of our folks were overinsured, and I know that in the last panel, there was conversation around, PPOs versus HDHP, HSA plans, and so we had an HDHP plan, but we weren't contributing to it. And so I'm really of the school of thought that we need to provide education, and as a healthcare company, we need to be better consumers of healthcare ourselves, while also not jeopardizing some of our own partnerships, because we do also have an urgent care business. And so we left Excelis, which was Blue Cross Blue Shield out of New York, but in doing so kind of jeopardized our relationship on the business side doing that. So we've done a lot of innovative things though, and we're constantly looking at plan design, plan cost, and trying to make trade-offs of what do our people need, but also while pushing folks to understand how consumerism of healthcare works, in the US, making sure that they have, care navigators and people that they need that can help them really navigate should a situation arise.
You raise an interesting point, because you are a healthcare company yourselves, and so I imagine there's a whole different set of expectations amongst your employee group than might be Pitney Bowes, for example.
Yeah. Yes and no. What's interesting is that I've worked, before this, I was always in tech companies, but healthcare folks are usually the least amount educated about how the healthcare system works, which I'm constantly like, what? This is like what you do. This is what you do. But again, insurance processing, all of that is obviously very confusing. But what's unique for us, I would say, is, so the other brands that we own a denture business, we own a vet business, we own medical aesthetics, and then we own, who am I missing? An urgent care business. None of those personas are the same. So what our vets are really looking for is going to be benefit plans that are different than that of our dentists, who are incentivized or motivated in different ways. And then thrown into the mix, we've got all the generations in our workforce. And so, what I always like to pride ourselves on, though, is like, as a healthcare company, we need to take care of our people so they can take care of you. And so that's something that we've really tried to ingrain into our plans, into our programs, is, making sure that we're keeping our folks healthy and safe on the front lines, so that they're, able to bring more care to more people.
That's interesting. That's a very complex business model.
Very complex.
Yeah, I'm gonna ask this next question to Sean and John. You are vendors to major employers, and what are they asking from you as far as showing the ROI on the work that you're doing with them in the flexible plans?
Yeah, I can jump in first. Well, yeah, everybody's asking for that, right? Show me the money on the ROI. It's a big one. So really quick, just context for everybody, since I didn't get to share this. So Forma, so everybody knows, we're a flexible benefits spending platform, which is a mouthful. The short version is, so 7 years ago, we started out with lifestyle spending accounts as our kind of initial offering. And the reason for that was we went, hey, the traditional like gym and wellness programs aren't catering to the whole workforce. We've got to find a better way to meet the needs of all employees, right? So we started there, and then we grew from there. We're in 110 countries now with over 80 use cases in the platform. So a great example is most of our customers run 3 programs on average. So it might look like a wellness-focused lifestyle spending account, along with a family formation account, so adoption, surrogacy, fertility, and then also running HSA, commuter, all in one platform. So that's just context of what we do. The ROI question is interesting. So just to share something I think hopefully you'll find as thought-provoking. So when we're talking about ROI, a lot of times it's the normal things: employee engagement, can we prove outcomes, right? Reduction in claims, healthy, happy workforce, recruiting and retention, all of those things. What we find, though, is 80% of our customers are able to transform their benefits net neutral budget. And actually, most of our customers save about 30% on average when they make this transformation. And so the reason for that, and we didn't realize this early on, so we were all focused on ROI, but the reason is 90% of companies out there are already doing a ton for their employees. Like, they've got wellness programs. We'll give you premium reduction if you do this. We have these type of stipends. The challenge we've run into is typically there's less than 30% engagement in those programs, right? So we're doing a lot, but it's not actually extremely effective. So what we started doing is we actually started doing audits with our customers and going, hey, let's take a look at all of your benefits. What are you spending today? How effective are they actually with the outcomes you need? And let's look at, can you consolidate some of these? And what we're finding is, more times than not, instead of new budget, they can actually just repurpose all the programs they're doing globally today in a more effective benefit. So then it becomes a much easier conversation with your CFO when we're saying, hey, I can take our programs today that are getting us 20% engagement. I can boost it to about 85% engagement without spending $1. And oh, by the way, the ROI is better employee engagement. If we have 85% of people engaging with these wellness programs versus 30%, the outcomes are going to be there, right? The health outcomes are there. The recruiting and retention bump is there because of these flexible benefit programs. So the interesting flip is, A lot of people are looking for ROI, but really you probably already have the budget to transform your benefits if you audit and take a look at what you're doing and find an effective way to do it.
So you're looking at consolidation, simplification, I would guess.
Consolidation, simplification to a point. So it's actually interesting. Most of our programs actually get expanded. So a great example is if you have a gym stipend. This is the simplest one. You provide $50 a month to your employees. Well, 20% of your employees go to the gym, right? So you're missing 80% of your employee population. So you can take that same $50, but now you transform that benefit. You provide holistic wellness. So they choose, is it financial health they want to use those monies on? Is it childcare? Is it gym? Is it clothing? Is it adoption? And so it is consolidation and yes, simplification, but actually also enabling organizations to offer more without the administrative headaches. Flexibility, okay. Exactly.
John, what are your thoughts on this?
Really good response. We're coming from a similar lens, SoFi, financial well-being, but I'll give my examples around some student debt programs that we've worked with companies. And if you're not familiar with Section 127, it lets companies contribute directly to employees' student loans, tax-free up to $5,250. So that's been in place since 2020. About 31% of companies now offer this. And so you mentioned outcomes here. And so a lot of companies that come to us, they have a specific outcome that they're trying to achieve. And to give one example, a very large health system out of Tennessee that was having a terrible retention problem with the nurses that they were bringing on. And so their hypothesis was these nurses, they have student loans. Not many other hospitals offer this type of program. Therefore, if we roll out a program where we're contributing to student debt and we tier that after years of tenure, that will help with retention. So we work with them, so you talk proving ROI, to initially make that case. It's one, what do we expect the participation in this program to look like? That will be that investment. So we help them with that. And then the return side is, okay, if we think about the impact on retention, let's get granular on what is the replacement cost? What are you currently spending on employees who leave your company? If they're leaving after a few years, the benchmark 6 to 9 months of that employee's salary, you can quantify that. And if you're able to save, let's say 100 employees based on that salary and that replacement cost, what would that be? So that's working on the business case. And then to your point, it actually has to work for you to want to continue to offer it. So what our team does, the customer success team does, is we evaluate, we help measure things. One is the employee engagement. So employees using the program, what impact is it having on student loans? So how much is it help paying off their student loan? How much are they saving on principal interest? The qualitative feedback, how it makes them feel. And then more broadly, the things we talked about. So a year in, how has this actually impacted retention? Has that gone down? And for that specific hospital, it improved the retention within 12 months by 40%. So it was, and there's obviously many other benefits on top of that that are harder to quantify, but that plays into the ROI that we initially discussed.
Well, and when you see a lot of people taking advantage of a benefit like that, that's a real clear indicator that it's going to do something to show your commitment to the workforce.
Absolutely.
Yeah. Nate, I'm going to come back to you on this question because you were the first to mention the cost of medical coverage. What can we actually influence as far as cost goes? And is it strictly benefit plan design and essentially cost shifting, or can we actually influence behaviors?
I don't know so much if you can influence behaviors. I think that's a difficult thing. We've got a large hourly population that, essentially their primary care is the emergency room. And we have tried for time and time again to get them to go to the PCP, select a doctor, go to the PCP on a regular basis. Annual physicals are no cost under our medical plan design. We've really have not been able to budge that. I mean, they just, I think part of it is it's a large immigrant population, and that's kind of what they know. And there's a lot of different reasons, access to care and things like that. So that's very difficult to change the behavior. But I think there are things that you can do from a resource standpoint to essentially try and increase quality and also decrease cost. So we've done a lot of different point solutions where it's targeted to certain populations based on their conditions. We partnered with CVS on a diabetes program. We did a pilot on it for one of our sites, and they really had a strong impact on being able to engage with the employees and manage the diabetes. Now we've expanded it to other areas. We've done other point solutions with a group called Walrus, where they essentially with people with chronic conditions or much more serious conditions, where they have a lot of prescriptions, and where a lot of times, unfortunately, multiple doctors are not talking to each other about all the different prescriptions. Walrus comes in, and they've done a fantastic job with engagement, and we'll talk to the participant about their mix of prescriptions, and we'll work with them to lower cost, lower side effects, and but essentially, better outcomes as well. So, I'm not so much a believer that you can, that sometimes people are just sort of, they're used to using healthcare in a certain way, but there are things that you can do, services and resources that you can offer that when the time is right, that you can really impact quality outcomes and the cost of care.
Yeah, sure.
Here, Pat. So just an interesting maybe thing to think about or consider that we're seeing across a lot of our customers is you have this kind of traditional model of wellness many times where, and I'm sure everybody in the room is like biometric screening, right? Some of your preventative, can we get employees to do more physicals? And it's that behavior change, which is really tough. What's interesting though, a lot of times is we're trying to incent that behavior change. So like, I'm going to give you this amount of dollars if you go and do a biometric screening, which we know only the people doing the biometric screenings are doing the biometric screenings and getting the $100, right? It's like, oh, I already did it. I might as well get the $100.
When you give them that stipend.
Exactly. So what we've started to see is actually a flip on the model where we're seeing companies that are using the programs that already have high engagement to drive then reward and behavioral change in the other areas. So and that program could be a lot of different things, but if you took a look at what are we doing, if we have 80% of our employees really excited in investing in this program over here, why not use that program to then educate and try to drive behavior and incentive in other programs? That's what we're seeing, and we're seeing a lot of companies have success with that model.
Great.
I just want to throw that out.
Well.
Yeah. Cory, I'm going to direct this question to you. As the top HR person, what kind of pressure do you get from your senior leadership team regarding cost, and how do you anticipate that?
Every year, my CFO and I walk into the meeting and he says, can't be more than 4%. So literally. And so he has set that bar very low for me and or high, however you flip it on your head. But what that means to me is he's coming along on the journey then, right? Like if we are setting almost what seems like an unattainable number for just from a renewal perspective, most people are saying 12, 14, 17%. He's coming to the kickoff calls, right? He's in the meeting, he's giving our brokers that. So they're not hearing it from me. They're not hearing it from my team only. They're talking to our finance folks and understanding of like, okay, well, what are the things that you, from a financial perspective, are willing to kind of trade in or trade up? And then also, we don't show all of our cards at once to him. So we keep things in our back pockets, whether it be credits that we have or, finding unique ways now that we are self-insured of having the plan fund some of these things, whether if we want to like add a different EAP that maybe the plan can pay for. And so I always focus on the pre meeting with my brokers of, we want to expand, but it's got to be be baked into the sausage, and we're not going to show Alex, my CFO, how the sausage is made. Because I learned a long time ago, it's to the point where we're talking about, utilization and that sort of thing. We're very hyper focusing on the things that we do well and the things that are going to hit the majority of our population, right? When you've got 23,000 people, finding fringe benefits that, the majority of people are going to use are really, really hard. And so, we've done a lot of things, I think, from a cost containment perspective to deliver that. And sometimes it is passing some of the increase onto our employees, which I don't love, but then there's other trade-offs of things that we've removed, right? Like you were talking about doing the biometric screening or the smoking cessation, just taking that out and being like, let's just give people the discounted rates, because if we start from a place where we know people aren't going to do it, or it's going to be even an administrative burden on the back end for myself and my team, let's remove those barriers to care and really kind of focus on the things that we can control.
Okay. Yeah, but not showing all your cards. I like
But not
that.
showing all of our cards. Oh no, we've got some, you know that.
Always keep something in your back.
That's right.
It's like, don't tell him that. Don't tell him we have this for next year, because we're going to need it in 26.
Yeah. John, could you say a few words about the financial well-being landscape? I mean, obviously employees, depending on what stage of their career they're in, have completely different needs. So how have you helped your clients with that?
Yeah, well, I saw a tweet within the past 24 hours that said if you don't make more than 23% since COVID started, you now have less money because of inflation. So
Thanks, whoever pointed that out.
right? I know. Yeah. Report to spam. But I think, so I mentioned we have 1,100 customers across all different industries. So law firms, manufacturing, tech. And it's interesting to hear, I think one commonality is it's not a one size fits all approach, because everyone has a unique set of problems. You could be a manufacturing employee who is on the front lines on an hourly salary that is struggling to make ends meet. Or you could be a lawyer who's working in New York City that has $3,000 a month rent and $1,000 monthly student loan payment. It's, different problems that you're trying to solve for. So you mentioned creative solutions, right, in that. One creative thing that, if we go back to 2018, there was a company called Abbott Labs that was finding that some of the younger employees weren't participating in their 401k match program, which was pretty lucrative. And when they did the research, they found that those younger employees couldn't afford that match because they had their student debt payment and all the other things that you have right out of school that you start paying for. So they asked the IRS, can we count the people that are paying money towards their student loan and then give them their 401k match? So pay off student debt, we give them the match. And the IRS said, yeah, but only you. So Abbott rolled that out in 2018. They got a private letter ruling. And we then started having companies saying, this is really creative. We're kind of finding the same thing. How can we do this? But legally, they couldn't. And legislatively, it started coming out that all companies could potentially do this. We had some companies in 2021 just say, we want to replicate Abbott. So we started helping them do that in 2021. And then Congress passed Secure 2.0 that now lets all companies do this effective 2024. So that's been very interesting. I had a conversation Monday with an energy company, and they're like, we have 20% of employees who don't participate, and that makes me really mad. And I think this program can really help there. So that's something that we're seeing.
I hadn't heard about that.
Yeah.
I'm going to go back to Nate and Cory. How do your employees feel, in your opinion, about your overall benefits offerings? And how do you measure that? Are you meeting their needs?
So it's, I think there are multiple ways that we get the idea of how they feel about the benefits. We don't do a specific survey, meaning other than during the enrollment period, but there's already a lot of surveys going out there on other things, HR related, business related, and we've heard from employees they feel overwhelmed by those surveys. So it's through a couple different methods. You really have to know your organization, and you have to listen to the HR business partners and the HR advisors. They're a great conduit. The talent acquisition team, they hear all kinds of things that are going on. And just listen to a wide variety of people in the organization. Go on site For last open enrollment, we went to a lot of our mail sorting facilities and we helped people enroll one-on-one, and we learned a ton about what's important to them. They will go to the medical plan that has the lowest payroll contribution, regardless of what the plan design is. They see the lower payroll contribution, that's for them. And then the other thing that was interesting too, we also offer a flex vacation package where essentially it's flex time and you're essentially buying a week of vacation. And you would think that lower income people, this wouldn't be interested in them. They were all of them were like, I'm already enrolled in medical, help me sign up for the flex days. Because they only get about 2 weeks vacation a year. A lot of them have family overseas, and they don't have enough time to go back home. But by buying an extra week's vacation, that gives them enough time to go back. So just things like that where we wouldn't have learned that if we hadn't been on the front lines with people. So you just really have to keep your eyes and ears to the ground. We do, as part of the open enrollment, we have, there is a short survey that's given, and there's a comments section. And people are very free with their comments. And yeah, they're even when there's years where there's no price change, people still complain, but that there was a price change, even though there wasn't. But so you have to kind of, sort through, filter through some of the things that's just noise. But you will come across things where you say, wow, that's an interesting idea. I hadn't thought about that. So I think there's not one way to hear feedback. You have to just constantly keep your ears to the organization and see what's going on and just talk to a lot of different people.
Okay. Cory, how about you?
I think, similar to some of the same things that Nate said, is really around understanding your population. And ours comes back to, again, just access to information, like how quickly can people find the things that they need? Because a lot of times it's just like, where is this thing that I need? Where is my dental card? Where's my medical card? Or this has changed. And, that is, causing distress because in the moment they need it. And so we did a lot of work around how we communicate to folks. Like I said, the majority of our population are within a four wall seeing patients day to day. They're not sitting at their computers. So why are we sending these long-winded emails? We want to send quick, easily accessible text messages, different ways of communicating with folks. And a lot of it was around, we heard things around things like mental wellness, of like, we don't have mental wellness benefits. Well, yes, we actually do. Our plans actually sponsor talk therapy within them, but folks didn't know about it. Or, we don't offer anything for, fertility benefits. Actually, yes, our plans do offer and cover fertility, but it's about educating people around the things and the noise that we hear in the system. We do an engagement survey. We were doing it quarterly. We've now moved to yearly, but a lot of the stuff that comes out of that when we're talking about, health and well-being or total rewards is money or sleep. And so sleep was actually a really big one that came out. And so we've partnered with a sleep benefit because, again, as a very diverse population, what does every single person do? They sleep. And when you can't always put money in, like sleep is something, and then when you dig into it, sleep is super foundational. It's foundational to your health. It's foundational to your mental wellness, if you're stressing about money, that sort of thing. And so, got kind of unique in the ways that we can promote other benefits that are low cost but high impact that can also reduce other health outcomes. And so, survey 100 people, they would be like, our benefits suck. But, it also depends on, how much are you willing to go and find the information. And for us, it's been a lot around making that information accessible, easy to understand, and not just hiding things in the noise or burying them in summary plan descriptions that nobody's going to read the 42 pages of whatever it says. Even I don't. So.
And I see a commonality in both your answers, which is know your people.
Know your people.
Yeah.
Absolutely.
We're moving along in time, so let me give this to Sean and John. How do we use flexibility in our benefit plans as a way to customize the offerings and recognize the diversity of the workplace?
Yeah, I'll jump in. So I think from a customization standpoint, we'll talk about the employee and mindful of time quickly, employee side and then the employer side. So one of the big things around customization really comes down to employee choice. So that's why you're starting to see an explosion of folks looking at things like ICHRA on the medical side, lifestyle spending accounts on the post-tax side. But what's important in that is that you have like a kind of programmed containment, so there's not too much choice. It still needs to be simple. So I'll give you an example on the employer side. So I was talking with the CHRO, healthcare company, 20,000 employees. And she tells me this story. She says, I had an employee who was like a nurse's aide, and her manager said she had a critical care patient. She could not leave for the day. So he's like, you have to be here with this specific patient. She got a call, single mom, child is sick at school, gets a call from school. She's got to go pick her child up. And so the decision now, she doesn't have anybody to pick her kid up, is do I potentially risk my job, or do I go get my sick kid? And I'll never forget, the CHRO goes, I've got 20,000 unique issues just like that. How do I solve all the needs? And the answer is you can't. And so what they do, right, is they use a lifestyle spending account where that mom now, if she needs backup childcare, she has dollars she can take to get it. But two other stories from the same CHRO post lifestyle spending account, they also had a employee who his wife had endometriosis, which, if you know, it's chronic pain. Traditional medical doesn't typically cover the therapies you need to manage that pain. So with a lifestyle spending account, they can actually now use those dollars on medication, and they're like, this is a game changer. Same company also had an employee that used their dollars towards adopting their first child and now has a family. 3 unique stories. So when it comes to customization, one of the biggest things we're seeing on the employee side is giving that choice. What matters to you right now? And then the other real quick one on the employer side is making sure you have benefits that are custom to your business. So one quick example, Microsoft. So they use our platform for 140,000 employees. They offer one global wellness account to all of their employees in 93 countries. But then they also offer bespoke or custom benefits in each country. So in Mexico, their medical plan doesn't cover yearly physicals. So in Mexico, they provide through the platform yearly physicals just for that population. They also get the holistic wellness. And so that's what we're seeing is these flexible plans, custom on employee side and employer side.
Okay. John?
I know we have less than 2 minutes, so I'll keep mine short. I mean, to go back to the commonality, it's knowing your employees, knowing what problems you're trying to solve for, and customizing solutions that can help you solve those problems. I think for us, it's if you're trying to solve the student debt problem, one common thing that we hear is, well, what about everyone else who doesn't have student debt? And even at SoFi, like our benefits person says, we offer a contribution program. There are employees who say, well, what about me? Why don't I get $200 a month? And say, well, do you wish you had 5 figures of student loans? Probably not. So you want to take that zoomed in approach while also, zoomed out from general financial well-being. And I know the last question is around the future of financial benefits. And I think offering things that can be personalized, whatever your financial issues may be, and help you.
Yeah, the personalization is where the flexibility comes in.
Definitely.
Well, I think we are just about out of time, so I appreciate all these perspectives and great discussion. Thank you.